We're going to be doing a bone marrow stem cell procedure to help this patient with his knee arthritis and his meniscal injury. Basically, we're going to withdraw the bone marrow from his pelvic bone, and we'll concentrate it, we'll process it, and then we will use it to inject into the knee, around the knee, to help it heal. Next, I'm going to mark the pelvic bone that we're going to use to aspirate the bone marrow concentrate. And we want to aspirate from the tallest part of her posterior sacroiliac spine, PSIS. And that's where most of the bone marrow stem cells are located. I'm going to use some chlorhexidine with alcohol to sterilize my injection site before I start numbing up the area. And then we're going to do some lidocaine to numb up the area where the bone marrow aspirate is going to take place. And just give it a good amount of lidocaine. And the idea is to numb up this whole area, so once I'm doing the bone marrow aspiration, the patient doesn't feel anything. So what we're going to do, we're going to use these sterile drapes to create what we call a sterile field. And that allows us to maintain sterility during this whole procedure. So now that the area is anesthetized and sterile, we're going to go ahead and introduce a trocar into the bone to pull out some of the stem cells. And I'm going to just use ultrasound to make sure we're in the right position. There we go. So now that the trocar is in place, we should be able to get some nice bone marrow aspirate. And you're going to feel a little pull, okay? And 1. And 2. Perfect. How's that? Not too bad? There you go. Now I'm going to introduce it just a little bit deeper. Pull. Rotate it. And then pull. Shannon, is that 6?
Yep. That should be the last 10.
Okay. Shannon is filtering the bone marrow concentrate through a filter and putting it all into a 60 ml syringe. We will use that syringe to transfer it to the concentrating device. I'm just going to remove the trocar and put pressure. So now that we have aspirated that bone marrow fluid, we will clean up the wound. We will put a pressure dressing, and we're going to go to our lab and process the bone marrow into a concentrate. So what I'm doing right now is getting Kathy ready for her procedure. We already collected some of her bone marrow from her pelvis that is being processed in our lab, and while we wait for the processing, I will get the knee joint ready for the injection. So what I'm doing right now is numbing up the area before we actually do the bone marrow procedure. The area has been sterilized with a surgical antiseptic, and right now all I'm doing is just putting a little bit of lidocaine, actually ropivacaine, into the area to numb it up, so when we do the procedure, it's not as painful. So now we have the bone marrow prepared. Here it is. It's bone marrow and PRP, and we're going to be injecting it inside the knee joint, and then I'll inject some also into the meniscus where the tear is. So you can see the knee joint on the ultrasound, and we're going to go ahead and insert the needle into that joint. You can see the needle going in. All I want to do is just get it in between those two bones. Kathy, doing okay?
Mm-hmm.
Okay, I'm going to go ahead and put some in. Can feel a little pressure. And you can see it spreading inside the knee joint. Now that the bone marrow stem cells are in the knee joint, next I'm going to put some into the meniscus, where the meniscus tear is. I'm going to put it into multiple areas just to allow them to spread. Next, I'm going to go ahead and do a little bit of prolotherapy around the knee joint and the kneecap. This will help to stabilize the kneecap into better position, and also will help stabilize the whole knee joint. The next step is for her to start the healing process. So she's going to be sore for a couple days after this procedure, but as the days go on, the knee is going to start feeling better and better, and we're hoping that within a few weeks it's going to start feeling a lot more stable as well. And the healing process begins.